When patients with scoliosis are looking for an effective form of treatment, one thing that always tends to come up is the concept of yoga. Can yoga actually be a treatment to reduce scoliosis to stop progression? And my simple answer is no, that yoga should not be used as a form of treatment. But yoga can be beneficial for things that are associated with scoliosis, and most important, pain and posture and rigidity and these types of things can definitely be used. Yoga can help use to help eliminate or deal with some of those effects as a result of scoliosis. But yoga should never be used as a treatment to try to reduce the curve. It must be used with other forms of treatment to benefit the curve reduction, and yoga being the exercise to help deal with some of the things that they're experiencing as a result of the scoliosis. So what are benefits of yoga? Number one is that yoga can help all types of patients with or without scoliosis to help deal with pain, because it helps increase flexibility and strength, and it helps recruit muscle. It helps increase lean out bodies, and those can help patients deal with pain. In addition, yoga can also help increase flexibility and range of motion. And it does this because you're holding these poses sometimes at the end of range of motion of a particular joint, and therefore it can help increase the flexibility and range of motion of that joint that you're holding in that pose. So when you look at all the benefits, I definitely recommend scoliosis is helpful for patients that have scoliosis, or any patient in general, because it can help. It's an effective form of exercise, and it tends to be safer because it's not as compressive. Now, where does this concept of yoga being a corrective form of exercise to help reduce or treat the actual size of curve? And I think this problem actually falls into place with some older forms of treatment of scoliosis, things like Schroth or C's, or other type of something we call self-corrective exercises using scoliosis-specific exercises. They tend to look similar, but they're very different, meaning they tend to be being that you move your body into a position and you're trying to hold that position that's going to be corrective for your scoliosis. The difference is that yoga wasn't necessarily designed to, yoga in general is not designed to actually reduce a curve. It's designed for overall body health and fitness and strength, flexibility. So it's not that I don't like yoga, it's that yoga is never designed to reduce a curve. And obviously there's many different curve types, and there's many different patterns within the curve, and there's many different flexibility points within that curve for a particular patient. So therefore, one yoga pose that could be good for this person may not be great for this person, and vice versa when we're looking at curve reduction. So the yoga pose being used to treat a curve reduction is not necessarily going to reduce a scoliosis. Now, scoliosis-specific exercises, something like clear isometric exercises, C's, Schroth, these types of exercises take your curve into consideration, and they're customized for each individual patient, meaning that patient will be instructed how to perform the exercise to get their best reduction of the scoliosis while performing that exercise. It's unique to that person's scoliosis pattern, and therefore it's going to be very dependent upon what they present with. Now, how can somebody benefit from adding yoga into their program and still benefit from the scoliosis-specific exercises that are reduced? Well, they share similar types of contractions, meaning when you do a yoga type pose, you're normally moving into position, you're holding it for a period of time, and then you're coming out of that position, and then you're moving into the next one. Well, scoliosis exercises that are specific, specific exercises, are done very similarly, that you're moving your body, holding it into a position that's going to reduce your scoliosis, but you're being trained by somebody that knows your curve type to deliver the very best result. So since their contractions are the same, that somebody with scoliosis who practices yoga could perform these scoliosis-specific exercises easier and more effectively once they're trained. So yoga can actually help us train or use the scoliosis-specific exercises more effectively. I find that when I train somebody in the self-corrective exercises or even the clear isometrics, somebody who does yoga typically can learn those exercises more effectively, and they learn it better, and they can perform them better because they have the strength and skill of yoga behind them. And we know yoga has like a 5,000-year track record in terms of helping patients or helping people build strength and flexibility, help with pain, help with posture. So yoga is a very effective form of general exercise, especially when you're being taught these scoliosis-specific exercises. Now, what can actually happen to combine the two? If I know somebody loves doing yoga and they still do it, and I teach them their scoliosis-specific exercises, patients that are very proficient can actually do both at the same time. They can learn how to hold yoga poses while performing the scoliosis-specific exercise at the exact same time. So they can actually get two results at one. Now, general yoga poses are not it. There's no general yoga pose that reduces a scoliosis curve. However, scoliosis-specific exercises can be trained into almost any exercise that you do. Not only yoga, but even sometimes weights, using weights, using exercise bands, using other types of exercises. Once you learn scoliosis-specific exercises, you learn the concept of it, you can be adding that into almost any exercise you do, but yoga tends to be the most natural. And I think that's where it tends to confuse patients, where they think yoga can actually be a treatment. So if you do yoga and you have scoliosis, you're actually preparing yourself to get better results with a scoliosis-specific program to help reduce your scoliosis and manage the progression.